My name is Erica, and my presentation is on body dysmorphic disorder, or BDD. Body dysmorphic disorder is a mental illness that causes a person to become fixated on what they believe to be a personal flaw in their appearance. They obsess over this perceived flaw and believe that it's as noticeable to others as it is to them, when in reality, it may not even exist, or if it does exist, it may be very insignificant. But the person obsesses over these flaws, and it gives them anxiety, loss of sleep, trouble in relationships, and makes it very difficult to interact with people and have a social life. The DSM-5 lists body dysmorphic disorder under the category of obsessive compulsive and related disorders. The diagnostic criteria for this disorder include a preoccupation with perceived defects in physical appearance, which causes clinically significant distress or impairment in important areas of functioning. The patient must have at some point participated in the performance of repetitive behaviors in response to their concerns, and the preoccupation cannot be better explained by eating disorders. So if they're obsessed with their weight, and it's better explained by an eating disorder, then they would not fall under the criteria for body dysmorphic disorder. 0.7 to 2.4% of society suffer from body dysmorphic disorder. People who suffer from this disorder also likely suffer from depression, social phobia, obsessive compulsive disorder, personality disorders, and or substance use disorders. There are different diagnostic screenings for this disorder, which include body dysmorphic disorder examination, the body dysmorphic disorder questionnaire, the body image disturbance questionnaire, and the dysmorphic concern questionnaire. These are all used to assess people who are presented and could possibly show signs of body dysmorphic disorder. These tests, these screenings are used to see if the person is actually exhibiting this disorder, and also to see to what severity they're exhibiting this. A lot of people who suffer with body dysmorphic disorder believe that cosmetic surgery will fix their flaws. So a lot of them seek to have cosmetic surgery. Unfortunately, only 2% of those people actually end up feeling better after the surgery. The rest of them either don't believe that that specific flaw was corrected, or they find new flaws. The reason for this is because BDD is a mental disorder, and you cannot correct a mental disorder through cosmetic surgery. Another branch of body dysmorphic disorder is muscle dysmorphia. This is a type of body dysmorphic disorder that causes a person to believe that they are lacking in muscle, no matter how muscular they are. The case study that I read about was on a 19-year-old who was in the hospital due to a suicide attempt and had been diagnosed incorrectly with depression because of the suicide. But the further they looked into it, they realized that this was an incorrect diagnosis. This patient had a belief that his face had severe deformities that would require surgery, and he was so upset about it. He felt like it would never be able to be fixed, and he showed delusion in explaining that when he looked at his pores in the mirror, they were sometimes as long as toothpicks, he said. So they realized that he was actually suffering from body dysmorphic disorder, and once they treated him correctly, he got through it and improved. So the treatments for this disorder are cognitive behavioral therapy and pharmaceutical treatments, including SSRIs. And the future research, we need to have research for studies that compare SSRI dosages, titration schema, and discontinuation outcomes. There's also a need for more research to be done on the ability to treat adolescents with medications for body dysmorphic disorder. I leave you with this information on BDD in hopes that you have found it interesting and informative. Thank you.